Hello, this is a short video to introduce and explain new key changes to the revised nursing documentation booklets being used at the Princess Alexandra Hospital, as some components of the original assessment booklet have moved to Nerve Centre. First, I will introduce changes and then show you how to complete the patient assessment and core care plan document. Key changes. Principal changes to the document include the booklet itself has been reviewed and refreshed, an overall reduction of the booklet size, the move of certain patient assessments to Nerve Centre. These are the falls, bed rails, Waterloo and must assessments. The oral hygiene, Abbey pain score, enhanced care assessment and discharge assessment have been moved also. Assessments and care plans with the red border need to be completed within 6 hours. There are 8 care plans in that category. Assessments and care plans with the green border need to be done within 10 hours of admission. 8 sections fall into this category. Patient demographic details. Page 1 is the patient demographic details. This contains the patient's details, record of belongings, and escalation plan. The escalation plan has been moved to the start of the document and should be updated as circumstances change throughout admission. Infection control assessment. As part of the admission, the patient should be screened for certain infections as part of the trust protocol. The initial infection prevention assessment is completed in the emergency department and is no longer in the admission booklet. At the bottom of the page is the care plan, which can be started and completed as necessary. Safeguarding adults and young people. The next 4 sections contain patient-specific questions to assess risk related to safeguarding, cognitive impairment, medication, and end-of-life care. This assessment must be undertaken for all patients. If the answer is yes to any question, then the appropriate action must be taken and documented on the patient record. Sample documentation. As an example of a completed care plan is shown here for your reference. Patient handling assessment. The patient handling assessment form has not changed. This must be completed for all patients on admission or upon transfer between clinical areas. It must also be updated on a weekly basis or when the clinical condition changes. Falls care plan. The care plan remains in the booklet to document the patient's risk score and care delivered for the patient. Pressure ulcer prevention care plan. On admission to the Princess Alexandra Hospital Trust, all patients should have an appropriate pressure ulcer risk assessment completed within 6 hours of admission. This is completed on Nerve Centre by a registered nurse. Based on the Waterloo score, there are recommended interventions that you may implement. You can pick actions from high-risk care plans or document specific individual needs at the bottom of the page. Pain assessment. The pain assessment has been shortened. If the patient has complex or chronic pain, please speak to the pain specialist nurses and sign the appropriate interventions on the care plan. Oral hygiene care plan. The oral hygiene screening tool has been transferred to Nerve Centre. The care plan remains here and daily documentation recorded in the care delivery document. Inpatient care. The next care plan documents the common interventions undertaken for a patient admitted to the hospital and sets expectations regarding their admission and discharge. Communication. The communication assessment has been shortened and includes recommendations on how to support the patient while in hospital. The patient must be asked what their baseline communication needs are and whether they have changed since coming into the hospital. Cognitive impairment and dementia. This asks the question, does the patient have a cognitive impairment? If the patient does have a long-term cognitive impairment, please complete the This Is Me document, place a forget-me-not poster above the patient's bed space, and give family a carer's information pack. The dementia clinical specialist nurse may be contacted on 01279 978 777. If the patient has a learning disability, please complete a hospital passport or purple folder and contact the learning disability team on extension 8742 or 2218. The next sections need to be completed within 10 hours of admission. Respiratory assessment. An acute and chronic respiratory assessment has been added to the booklet. If a patient answers no to all questions, the form must be signed and dated that no care plan is required. Patients presenting with exacerbation of COPD, asthma and home oxygen users should be referred to the respiratory nurses. Nutritional and hydration assessment. All new patients admitted to the hospital need to have a nutrition and hydration assessment done within 10 hours. Must assessment is still undertaken on nerve centre and completed within 6 hours or whenever the patient's condition changes. Diabetes. The diabetes assessment is used to assess the diabetic patient's usual regime and their ability to manage this independently. If indicated, the care plan may then be completed. Elimination. Assessing the patient's typical bladder and bowel function remains important. Any areas of altered function can be addressed in this section and care planned accordingly. The Indwelling urinary catheter insertion tool is here to assist in the decision-making process. Personal cleansing and dressing. In this section, the nurse can record the patient's usual level of function and the degree of assistance needed. The care plan has space for individualised strategies to meet the patient's needs. Lifestyle. Here, aspects of the patient's social history are recorded. Any social issues can be identified and appropriate discharge planning initiated. There are no core care plans, as this care plan needs to reflect the individual patient's needs. Care delivery document. I will now discuss the correct completion of the care delivery document. The care delivery document contains the following: patient body map, SSKIN Bundle documentation chart, oral hygiene documentation, invasive devices documentation, and body map for peripheral lines. The registered nurse is responsible for the completion of the document. Record keeping can be delegated to healthcare assistants, assistant practitioners and nursing students, but the accountability remains with the registered practitioner. Body map. On the first page is a body map to record all wound types noted on the patient's body. A list of codes for different wounds can be found on the right-hand side together with guidelines on completion. Each wound must be noted on the list with the time, date, wound description and wound measurements. Invasive devices documentation and peripheral line body map. The invasive devices documentation and peripheral line body map are like the old forms. The only difference is the removal of the section dedicated to indwelling urethral catheter care. Daily indwelling urethral catheter care plan. Patients with indwelling urethral catheters need to have the indication for maintaining the catheter reviewed daily. If it is not essential to maintain the catheter or signs of a catheter-acquired urinary tract infection are present, then follow the trial without catheter care plan. SSKIN Bundle documentation chart. The SSKIN Bundle documentation chart is a modified version of the current repositioning chart. The validation section at the bottom of the form has been removed. A booklet normally contains enough space for 7 days of documentation. Food and drink record chart. Next is the food and drink record chart. This provides space for up to 48 hours of intake to be recorded, which will help evidence the need for input from a dietitian. Oral hygiene documentation chart. Oral hygiene is a continued drive in the hospital at present. This new section offers staff pictorial advice and space to document episodes of oral care delivered. Enhanced care plan. While the enhanced care risk assessment is on Nerve Centre, the care plan remains in the care delivery document for reference. The ABC observation chart is still in the booklet for documenting patient behaviours and staff reactions and interventions, as is the enhanced supervision record. Conclusion. That concludes this presentation on the new nursing documentation. For any queries or feedback, the practice development team is always happy to help. Our team can be reached on extension 8232. Thanks for watching.